Welcome to our February Live Well Bethel Park program on help for seasonal affective disorder, known as SAD. Seasonal affective disorder can give us the winter blues, make us feel down, sad. Symptoms may include losing interest in activities, having little energy, sleeping too much, difficulty concentrating, and even gaining weight. I am proud to introduce Sabrina Platt, a family nurse practitioner for St. Clair Medical Group. She's going to help us delve into this important topic. Sabrina has her doctorate in nursing practice from Robert Morris University and works for Fady Gaddy, Naley and Associates in primary care. She enjoys thoroughly serving the South Hills community. Welcome, Bethel Park. Welcome, Sabrina.
Thank you very much. Well, my name is Dr. Sabrina Platt. I am a family nurse practitioner with St. Clair Medical Group, Fady Gaddy, Naley, and I am excited to share something about a lot of people may be feeling right now, and that's SAD, or sadness. And it's not the emotion SAD, but an acronym for seasonal affective disorder, which is a condition that actually affects a lot of people during the winter months. So now is the perfect time to learn about this disorder. If you feel any of the symptoms I'm about to discuss, please know that you are not alone and there is treatment. So have you ever felt off during the January, February months and you couldn't figure out why? Well,
all the time.
All the time. Well, winter may actually be to blame. Less sunlight during the day affects how our bodies regulate serotonin and melatonin. And when levels of these hormones are thrown off, it can affect our mood and sleep. Other possible causes include circadian rhythm disruption and genetic factors. For some people, this disruption can be dramatic and lead to a type of depression called seasonal affective disorder, or SAD. Signs of SAD include weight gain, fatigue, trouble concentrating, sleeping too much, slowed movements or speech, feelings of guilt or worthlessness, and other things that make you feel not like yourself. 5 or more of these symptoms are enough for a provider to diagnose you with SAD, but many more people have what is called subsyndromal SAD, where you're not completely disabled by winter, but you're not at your best. Treatment can include medication and light therapy. Sitting in front of a light box for 30 minutes a day before the hour of 8 a.m. can actually trick your brain into thinking that it's daylight. Be sure to choose a light box with at least 10,000 lux. You can find light therapy over the counter, but be sure you talk with your primary care provider for a diagnosis, as treatment for SAD can make other conditions like bipolar disorder actually worse. Other ways to fight off the winter blues include getting outside to soak up as much natural sunlight as possible, exercising daily, and forcing yourself to be social. Schedule a lunch or an outing with a friend, even if you don't feel like it, can actually help your mood. Also, your diet plays a big role in how you feel. Food is medicine. Reach for green leafy vegetables, healthy carbs, and even the occasional dark chocolate. So just to review, SAD is a type of depression that usually begins in the fall or winter and fully resolves in the spring or summer. We believe that this happens due to less sunlight during the day. Daily exercise, a healthy diet, and supportive social interactions and medications can be used to treat SAD. Follow up with your primary care provider or your mental health professional if you think that you are dealing with these symptoms.
Okay, I have a question for you. People with depression or bipolar or a mental illness more susceptible to getting seasonal affectiveness disorder?
Yes, absolutely. So those people who already have a diagnosis of depression can get seasonal affective disorder, where winter is absolutely incapacitating. Where, as I mentioned before, those people who don't have a diagnosis of depression, they can feel those subsyndromal symptoms.
Okay. What's the biggest factor in it? You named 4 or 5 factors. Is there one the biggest? Weight gain? Is it?
So the side effects that you may be feeling, yes, absolutely. So weight gain, fatigue, slowed movements or slowed speech, And even things like feeling worthlessness or guilt, or even having suicidal or homicidal ideations are big things that we need to look out for.
Is there any natural remedies besides, pharmaceutical side?
Yeah. So medications always, but I am a big proponent of exercising, getting outside as much as you can, raising your heart rate, and for 20 to 30 minutes every day can really help you feel better, especially during these dark winter months.
What else can you do for it? You mentioned the light therapy.
Light therapy, yeah, light therapy. Get in front of a light box 30 minutes a day before 8 a.m. And then really fueling your body with good, healthy foods.
It's hard for some people.
It is hard for some people, but
it seems like it's a cycle when you get depression or sad. You reach for the comfort food.
You do reach for
which
comfort
doesn't
food.
help you with it, but that's what you reach for.
Exactly. Yes, you do have the want and the desire to reach for simple carbohydrates, but that's one thing that we can do is reach for healthy things. Yep.
Yeah, I know a lot of people, they dread winter coming. Oh, it's gonna, the sunlight's half the time. It's, it's kind of, you get to work and it's kind of light up, but not really. And then you go home
and it's dark.
And it's like, and especially in Pittsburgh, you got to get out with. Today's a typical Pittsburgh winter day. It's just
gray.
There's not a lot of sunlight,
There's not a lot of sunlight.
So, how can you combat that when we live in an area that has like 39, 40 real sunny days a year?
Right. That's a really good question. And again, it's being social even when you don't want to. You go home and it's dark out, but still surround yourself with good, healthy, supportive people. That can help elevate your mood.
Quick question. Have we seen SAD go up more because of the internet and all the social media and people not getting out as much?
I haven't seen any correlation with that. However, there is a tendency, a rate increase. We do see SAD whenever you're further away from the equator. So as to whether there is a social media impact, I'm not sure about that.
Oh, okay. So move south then.
Yeah.
Apparently would be a big help.
Yeah.
So, Sabrina, are there tests for SAD?
So just a simple talking to your provider can actually provide the diagnosis of SAD, but we might consider drawing some simple blood work to rule out other conditions.
So would it be helpful to take a quick 4-day vacation to a sunnier climate to help you through the winter months?
I mean, of course, I'm all about vacations and self-help and mental health care. However, the light therapy is actually a really good way to combat that. If you do light therapy for 1 to 3 weeks while you're at home during the winter months, you can actually feel a marked improvement in your mood.
It's interesting. So it's just the environmental factor of not getting enough sunlight.
That's it. Not getting enough sunlight.
I never thought about it that way. It was always called the winter blues, and no one really talked about it. And I was like, because you're not getting enough sunlight and vitamin D, I think it's.
Yeah, vitamin D is in there as well. Yeah, unfortunately, it does. Seasonal affective disorder does have a bad PR rap. A lot of people think it's just fluff. However, it's a real diagnosis.
If people still don't give mental illness the attention it should, it's still it's.
No, you hit the nail on the head. There's a real stigma around mental health, but your mental health is a part of your overall physical health. So I think that we should all be exercising, addressing our needs, addressing the way that we feel internally at all times.
Being in an office all day and then going home, you're in front of the TV, the internet, and all that. Is it more pronounced when you do that?
Well, you would think so, yes, because you have to think that you get up whenever it's dark outside, you go into an office that may not have windows or access to light, then you leave the office whenever it's dark outside, and then what do? You're just kind of isolated. So you're already creating this isolation period, so that's why we always suggest going out even whenever you don't feel like it, to really reconnect with those people that you find supportive.
Oh, that's a good option, or just go take a walk around,
Yeah.
local mall or
Yep,
your community center or somewhere, and just get out. And
exactly.
even if you're not seeing the people you really know, at least you're getting some human interaction.
Exactly. And also the exercise if you're out, going to your local community center and walking. Yep.
Sabrina, thank you for doing our show tonight. It is a very important topic that I think needs to be addressed more. Not just SAD, but all mental illness, so we have a better understanding of it. So we thank you for doing this very important topic. And Bethel Park, make sure you continue to live well. And thank you for tuning in.